The typical method of reconstructing the breast after cancer surgery is to use an implant. But as Healthy Living reporter Susan DeLeo found, a plastic surgeon at St. E's is now using the patient's own skin.
Women who have had breast cancer surgery now have a new option. Instead of getting a silicone breast implant, they get an implant made of their own tissue. Dr. Michael Obeng is the chief of plastic surgery at St. Elizabeth Medical Center. He explained the process to me, called autologous reconstruction.
You take the fat, the skin, and the muscle, your rectus muscle, and then you rotate it into the breast defect.
Dr. Obeng, new to Humility of Mary, is Harvard Medical School trained, not only a plastic surgeon, but a microsurgeon. It's a very time-intensive surgery. After the breast cancer surgeon is finished, he comes in to perform the reconstruction, an 8 to 12-hour procedure.
You know, you take the tissue and there's blood supply, and then you transfer it to the chest wall. You know, you fill in the defects, and then you hook up the blood vessels near either, near the sternum.
Not everyone's a candidate for the surgery, which takes fat from the tummy or back to fill in the defect, but it eliminates the wait time between cancer surgery and getting an implant. And to get artificial implants, you must wait until after radiation. Tomorrow, we meet one of Dr. Obeng's patients who had the reconstructive surgery just 3 weeks ago, already bouncing back well enough to care for her 16-month-old nephew. With Healthy Living in our Valley, I'm Susan DeLeo.
There are new options for cancer patients who need reconstruction after surgery. In part 2 of her Healthy Living series, Susan DeLeo introduces us to a patient who chose a different kind of implant.
Charlotte Vejana not only has 3 children, but is also caring for her 16-month-old nephew, Michael. She's bouncing back from a surgery just 3 weeks ago.
They called me in for my result. That's when they told me I have breast cancer on my left side. I just went ahead and told them to do the mastectomy.
She had discovered a lump 3 months earlier. The cancer surgery was September 13th. She had turned 40 the day before. Instead of waiting to get a silicone implant, she opted for something else.
It's just part of your flesh, you know. It's not anything else that you're going to have to worry about. It's part of your body. Get to...
And there's a tummy tuck, too.
Tummy tuck, too.
Yeah, that was nice.
That's the best part of it.
It was an 8-hour surgery, but after the cancer surgeon was done, Vejana's doctor came into the OR and, using part of her stomach, created a breast implant. Dr. Michael Obeng explained to me the decision to get breast reconstruction versus implants depends on many factors.
That's why I tell my patients, like tires, you have to be rotated every so often. Every 7 to 10 years, you have to go back to your surgeon.
Now Vejana faces chemotherapy and another operation with Dr. Obeng on the other side to even out her anatomy.
I feel wonderful.
You look great.
Feel good. It's a good start.
With Healthy Living in our Valley, I'm Susan DeLeo.